You type a symptom into ChatGPT. It gives you an answer in seconds. It sounds confident, clear, and reassuring. But what if that answer is incomplete? What if that incomplete answer means you delay seeing a doctor when you really need to? Back in March 2026, an Australian cancer surgeon, Dr. Sanjay Warrior, noticed something that worried him. More and more of his patients were showing up, having already asked ChatGPT about their symptoms. So, he decided to test it himself. He typed in a common symptom: breast redness. Now, this can be a sign of inflammatory breast cancer, a condition that needs urgent medical attention. ChatGPT's response: wait a few weeks to see if it improves. Wait a few weeks. For a condition where early evaluation can dramatically change treatment outcomes, this was a dangerous suggestion. Dr. Warrior published his findings, and soon, doctors all over the world started testing these AI systems. The pattern was consistent. AI chatbots often gave reassurance when what was really needed was a professional medical evaluation. And it's a huge issue. A 2024 study found that nearly 10% of Australians had already used ChatGPT for health advice. Globally, it's estimated that 40 million people use AI for health information every single day. What's alarming is that over 60% of those people were asking questions that should have been discussed with a real doctor, not a chatbot. So, why are so many people doing this? It's convenient. It's accessible 24/7. But convenient doesn't mean appropriate. As Dr. Warrior explains, if an online tool says something is probably fine, some people will put off seeing a doctor. Imagine someone who's already anxious about their health. A chatbot tells them, it's probably nothing, just wait and see. They might wait far longer than they should, delaying a diagnosis that could have made all the difference. Research published in The Lancet Digital Health in early 2026 looked at how AI handles medical information. The study was massive, testing 20 different AI models with over 3 million medical prompts. The results were startling. The AI systems accepted medical information that contradicted established medical knowledge about 32% of the time. They were also more likely to believe false medical claims if they were written in confident, authoritative language. This reveals a critical flaw. AI excels at recognizing patterns and generating text that sounds plausible. But it doesn't actually understand or verify medical accuracy. It doesn't check medical databases or peer-reviewed research. It just generates text based on the patterns it's learned from the internet. As one researcher put it, these systems can treat confident language as true by default, even when it's wrong. OpenAI, the company behind ChatGPT, even includes a disclaimer. This tool is not intended for medical diagnosis or treatment. But how many of us actually read those warnings? Now, to be fair, there are stories where AI is helpful. One woman used it to understand the complex medical terms on her biopsy results, and her doctor confirmed the explanation was accurate. So AI can be useful for understanding information you've already received from a professional. But that's not the whole story. For every case where AI helps explain something, there are others where it gives incomplete or misleading guidance. And those cases, where someone gets bad advice and delays seeing a doctor, don't usually make headlines. That's the risk. You just don't know which answer you're going to get. Even when tested against official medical guidelines, AI has its limits. One study found ChatGPT did well with treatment recommendations that had strong evidence. But when it came to areas where medical judgment is crucial, its accuracy dropped significantly. This shows us that AI is best when following clear rules, but it fails precisely where a human expert's experience and intuition are most needed. What's really concerning is that studies show people with lower health literacy are more likely to rely on AI for medical advice. The very people who could benefit most from a doctor's guidance are turning to a less reliable source. So, what's the takeaway? Dr. Warrior puts it perfectly. AI tools cannot examine you. They cannot feel a lump. They cannot assess your individual circumstances. They cannot know your medical history. A qualified healthcare provider does all of this. They conduct a physical exam, ask detailed questions, consider your unique history, and order the right tests. AI can't do any of that. So how should we use AI for health? It can be a great tool for learning. Use it to understand medical terms, to get background information on a diagnosis you already have, or to prepare questions for your doctor. But it should never replace a professional. It shouldn't be used to decide if you need to see a doctor. It should not be used for self-diagnosis or for reassurance about a symptom that's worrying you. If you notice something unusual, if a symptom concerns you, if something just doesn't feel right, make an appointment with a real healthcare professional. Yes, it takes time. Yes, it might cost something, but a personalized medical assessment is something AI can never provide. Technology can support healthcare, but it cannot substitute for it. Your health isn't just a data pattern, it's specific to you, and it deserves a specific human evaluation. Thanks for watching. If you want to stay updated on health and science, subscribe to the channel. Have you noticed AI's limitations in other areas? Let me know in the comments. And remember, when it comes to your health, qualified professionals are always your most reliable resource.